How much do you know about eye health and eye diseases? Today, let's talk about age-related macular degeneration. Now, February of every year is set aside to create awareness on this age-related macular degeneration. Why? Because it is one of the leading causes of vision loss among older patients. Now, this is a situation whereby older people who are from 60 and above complain of not being able to see people's faces. That when they look at people, they can tell who is coming, but their faces are a little bit obscured and it's not clear. Now, this is one of the ways that they describe this age-related macular degeneration. As an optometrist, we usually carry out a dilated examination whereby we assess the back of the eye that is responsible for central vision, which is called the macula. Now, the macula is responsible for the central vision of the eye. Now, this central vision is a part that we use to see clear and sharp images. Now, when this part of the eye begins to degenerate, now the person is no longer able to see people clearly. What are the common factors that can lead to this problem? The number one is actually smoking. If you are a smoker, you really have to think about quitting, because the more you smoke, the more you increase your chance of having this age-related macular degeneration problem as you get older. If you are someone that cooks with firewood, that means you expose your eyes to smoke. You also have to cut down or find a way to protect your eyes when you are dealing with firewood or smoke. And then age is another factor. The older we get, the higher our chances of developing this disease increases. Then gender is another problem. Now, we see this disease more often among women than men. Now, this might be due to our exposure to smoke. I'm not so sure, but I know that women, or maybe because we tend to live longer than men, whichever be the case, it's been found that more women experience this disease than men. Another factor that can contribute to this is also family history. If anybody in your family, your parents had this, the chances are high that you too will have it. And then we have systemic diseases such as hypertension or diabetes, or you are overweight. If you are overweight or you have hypertension, you have diabetes, then chances of you developing this disease is also high. What can you do if you have this disease? Now, you have to look at this as it has to do with age. So there isn't much you can do, but there are a few things you can do. Before we get into that, we need to understand that this disease, there are actually of two types. You have the dry and you have the wet. Now, the most common one that we see is usually the dry. And at this stage, you can't do much except some lifestyle modifications as well as diet modifications. Lifestyle modifications such as quitting smoking is number one, and also avoid exposing your eyes to smoke is another thing you can do, and then reduce exposing your eyes to harmful UV rays. Other lifestyle modifications you can actually do is make sure you wear UV protected sunglasses as well as wide brim hat when you're going out under the sun. And also exercise as much as possible to reduce your chances of becoming overweight or developing systemic disease. Now, let's talk about dietary modifications. You have to be conscious of what you consume, especially the kind of food you eat. By increasing your intake of vegetables and fruits, you actually reduce your chances of developing this disease, because when you take these vegetables, they are filled with antioxidants that is actually very good for the back of your eyes. It keeps your macula healthy. And then your doctor can also place you on certain supplements, but they have to be ARET2 supplements. ARET2 supplements are supplements that contain vitamin C, vitamin E, lutein, zinc, and zeaxanthin, among others. But these 5 elements are very, very important. Now, all this will not actually prevent you or treat the macular degeneration, but it will surely slow down the progression of this degeneration, thereby keeping your macula healthy and keeping your vision clear for a longer period.